Well, it's World AIDS Day on Sunday, and 6 million people across the globe are infected with the virus. South Africa carries the world's heaviest HIV/AIDS caseload, with around 2.5 million people taking ARVs daily. Well, what are corporates doing to help the situation is one aspect, and what are the NGOs is another. Now we'll be joined by Thembi Zulu, who is Executive Director at Right to Care. Good morning, Thembi. You're a medical doctor, so you have that kind of expertise firstly, but you're involved in Right to Care. First of all, just give us the landscape of what Right to Care does.
Okay, Right to Care is a truly South African NGO. We are funded by the US government as well as by the Global Fund, and we get funding to strengthen the health system in the country, mainly in conjunction with the public sector, focusing on the implementation of HIV and TB programs. We use a lot of technology and innovation to improve the quality of patient care. And I think with the way that the health landscape has moved, we have found ourselves moving closer and closer to the concept of the ideal clinic, where we find ourselves not just only offering HIV services at our clinics. So if you have a male client who comes on board, he gets an HIV test. If he tests HIV negative, you immediately refer him for circumcision. If you have a woman coming to the system for any other reason, you want to be sure that you screen her for cervical cancer. So we've broadened the range of services in line with the needs of the patient. But I think the ultimate reason for the existence of Right to Care is to make sure that healthcare in the country is affordable and it's accessible.
Give us an idea of how much money that you have to spend and how you use it.
At present, our current budget, you are aware that we've gone through some recessions and the US did limit their funding. We are still sitting at a budget which is quite healthy of about 400 million rands per year as a company, and we get funded to implement services in 4 provinces nationally. And this is working with the Department of Health in all these provinces. So it's quite important to note that even though the model has changed, we're no longer doing direct service delivery as expected. A lot of the work that we're doing is technical assistance, which is training, mentoring, and making sure that the pharmacy systems work, the logistics, the management of stock, making sure that drugs are available at the Department of Health sites. So we've had to stretch each dollar a bit more, but it's still manageable.
It's obviously a public-private partnership. The danger of these things is that, first of all, there's turf territory wars, so we're doing this, no, we're doing this, and that you bump into each other, and you can actually make things worse by bumping into each other. How well is that partnership working?
I think it's worked well over the past maybe 3 to 5 years. With Minister Motsoaledi coming on board, what has happened is that the Department of Health has actually taken control in terms of coordinating the donor aid that comes into this country. And once the Department of Health is in control, they define what projects they want, they define the areas that need help, they define the monitoring and evaluation systems that we use, and we are uniform in terms of the indicators, in terms of the coverage, and especially for the areas that are more in need. So we've been rationed throughout the country, and there is no district that doesn't have the PEPFAR support on top of the Department of Health support.
Sounds good. I'm going to come back to the reach of your organization, but joining us now is Nicholas van der Nest, who's Divisional Director of the Risk Product at Liberty. Good morning to you, Nicholas, joining us from Cape Town. I've been talking to Thembi about the on-the-ground operation of Right to Care. Let's just take a little bit of a step back and up, if you like, and look at, as you see it, the landscape of HIV/AIDS in South Africa. Since the ARVs have come in, it certainly seems better. From a risk point of view, where are we?
I think from a risk point of view, we've made massive strides. The reality is that the introduction of ARVs in South Africa has increased the life expectancy of HIV-positive people drastically. And that, obviously has had quite a big impact on the insurance industry. And as you may have seen yesterday, we actually decided to extend our life insurance coverage to HIV-positive individuals as well. Really all of that was just brought on by the fact that HIV-positive people are expecting life expectancy of around 80% of a HIV-negative person.
Nicholas, just stop there. I wasn't aware that, if I was aware, I'd forgotten that you didn't offer, the industry didn't offer life policies to HIV/AIDS because obviously the risk was too great. The actuaries obviously have been keeping a close eye on this and continual revisions, but this is perhaps the most significant step from an industry point of view, which has to unfortunately take a cold eye on the level of risk. To offer life insurance policies is clearly perhaps the biggest step since the ARVs began to be rolled out.
Definitely. I think the industry is definitely ready for a new era when it comes to looking at HIV positive lives. The reality is that previously some companies did offer some form of limited cover to HIV positive individuals, but there were generally conditions attached to it. We started off many years ago by only offering term products. That meant that you only could get cover for about 5 or 10 years, and thereafter you wouldn't have any. The most recent innovations really looked at asking individuals to prove that they are adherent to treatment. So basically somebody had to go on a 3-monthly or a 4-monthly basis and prove every time through their CD4 and viral load tests that they are actually taking their medicines. The reality is that as an industry now, we've taken a massive step forward by saying that it's no longer necessary to actually provide us with that adherence. And we can now offer cover pretty much on the same terms as everyone else, obviously just with a slightly higher premium.
Well, that certainly sounds extremely encouraging. Timmy, from your side, I suppose you are, in a way, are the other half of this arrangement where you actually have to vouch for what's going on. You're speaking for the efficacy of all these schemes and treatments.
Yes, that's true. Essentially, I think what Nikki is referring to is as much as they don't require the patients to demonstrate the monthly adherence, their underwriting criteria at the beginning are quite strict. So if you are not suppressed in terms of your viral load, they would not take you on. So there is a level of demonstration of commitment that you have to show prior to qualifying to be on the treatment program. Because from our perspective as clinicians, antiretroviral therapy is for life. You need to be compliant with your medication in order for that life expectancy to be normal.
You also work with corporates. It's not just out there on the ground with clinics. How does that work?
Right to Care has got a division which is called Right to Care Health Services, and this is a company that focuses on making sure that employees of corporates are healthy, they are at work, they are productive. So essentially the business case, I think, for HIV has been made, with HIV being a business risk and business needing to invest in HIV programs to ensure that it adds to their bottom line. And we all know that when times are tough, business would tend to say, as much as I'm committed to the wellness and the health of my employees, if my employees can get treatment from the public sector, why should I pay for that? So the soft issues get cut in that instance. There has been commitment from the private sector. I think we met with the minister yesterday, and he mentioned, that he's gathered quite a few corporate CEOs, and they've committed to assisting the government to improve the number of PhD graduates in the country and to help him in training of the CEOs in the hospitals. So essentially the commitment is there from the private sector, but we could still do a bit more.
Nicholas, your sense of businesses' reaction to what was a major crisis not long ago?
In terms of business, obviously, when you look at your corporate schemes, like Tembi said, there's been a massive withdrawal, even just in the risk industry. Corporate schemes tend to try and get the cheapest premiums for their cover, as all of us do through the economic crisis.
Tembi, looking at your own personal role in this, you're a medical doctor. Now, there are lots of ways you could use your skills. Why are you doing it with Right to Care? And I suppose that's another way of asking, how fulfilling is it? Because it could easily be a very frustrating world, but it doesn't sound like it is. It sounds like it's working well.
I think personally, it's the satisfaction for me comes from seeing the difference that I make. And I think a good example that always comes to mind is that of a 2-year-old child that is not able to walk because they're HIV infected. You start them on antiretroviral therapy, and they learn to walk when they are 3 or 4, and only start riding their bicycle when they're 5 or 6. That is something that is quite fulfilling. Being with Right to Care for me has meant that I'm able to provide the Department of Health with data and information that we collect using our systems, and to influence national health policy in this country. Nothing could be more fulfilling than that.
Well, it's great to have had you to talk about it, and Nicholas van der Nest, the Divisional Director of Risk Products at Liberty, was talking to us from Cape Town. And Tembi, I have to declare, I'm happy to declare an interest that I know your chairman very well, Ali Bach. I've just done a cricket book with him, and it's fantastic that he's involved in this using his long experience. So it sounds like a good team.
Thank you.
Thanks very much to Tembi Zulu, who's our Executive Director at Right to Care.